Hey, I'm Dr. William Hammesfahr. I'm the board certified neurologist of 30 years who is setting up these videos for my friends, doctors, family, nurses, all who've asked for the recipe of how you get better from a serious neurological problem. And there's a couple steps to getting that better. There are components. We talked about that before. The components essentially are recovery for recovery. It's recovery, rewire, rehab, psychosocial, behavioral issues. Those 5 components all need to come together at the same time for recovery from a permanent neurological problem. But having said that, one of those major components is the subject of today's video, and that is how do you find a good doctor for your problem, and also about experts, medical experts. So let's talk about finding a good doctor first. Finding a good doctor is not really about finding a good doctor, it's about finding the doctor who has the right process. Medicine is not really about the doctor at all. It's really about the process of getting better. Medicine is very complicated. Illnesses are very complicated with many different components to illnesses, many different factors to it. We know that just in general, even something as simple as the flu has a component of fever, nutrition, anti-inflammatories, treating the virus, the immune system. There are many different components to it. And that's true for very serious neurological problems too. So the process is not really about finding the doctor who knows each of those components, but rather finding the doctor who has a process that can address those components and address making sure you get better. In everybody, how those components interplay is different. And so the exact medications used, the doses used, the types of medications, and the types of therapies change. Now, I've been treating people since I entered medical school as part of the Northwestern Honors Program in 1976. And this is now 2020, so I've been treating people who are involved in their treatment for a very long time. And in that entire time, I've never seen 2 people treated exactly the same way. And that's basically true for anybody. Your care and your recovery and your loved one's care and your loved one's recovery is going to be completely different in many different ways. Doses, medications, the nuances, as well as often the major components are going to be different from your neighbors who may have the exact same problems. In fact, with neurological conditions, we'll have the same neurological problems at some point, are the odds. So it's about the process. A while ago, I was involved in auditing medical care throughout different states in the country, specific practices, as well as looking at physicians' practices in universities, in major medical groups, as well as in university-based systems, like I mentioned, and in private practice. And there's a pattern to physicians who get good results and physicians who get bad results. The physicians, I gotta say, are all smart universally that I came across. Maybe less than 0.5% I thought really should not be practicing medicine. But the rest of them I thought were all universally smart, but the process they used for treating their patient was different, and that accounted for the outcomes. The process is essentially that a patient comes in with a diagnosis, or a diagnosis is made, and the physician starts his treatment. And then the good physicians and the good offices will have constant, frequent follow-up with that patient, either by phone or nurses or email or chat groups, constantly checking on the patient to make sure they're getting better. And if they're not getting better, then there's a revision, either a dose medication revision or actually a complete change of medications. That's crucial to the process. Let me give you an example from my practice. We had a patient who came in who was partially paralyzed and couldn't move his hand and his arm, and we started getting better with certain medications, but he was still left with severe weakness. We went through 39 different medication changes before we finally found the medication that worked to get his hand back. We got his hand back about 80%. We called that patient number 39 because we went through 39 different changes of medications and complexes of medications. So it's more about the process of seeing what works and what doesn't work, and then adjusting it and modifying it. So how do you find a good doctor? It's actually very simple. First, check them out online, but you have to take that with a grain of salt. The second thing is to go to the physician's offices and just sit down and watch what happens. What you're watching for, and you're going to talk to the other people in the waiting area, is the question of are they getting you better? Do they seem to be listening to you? But most importantly, if you've got a serious problem, when do they tell you to come back? Do you tell you to call within a couple days? Do you tell you to come back in a week if you're not getting better? Do they give you guidelines? If you come back in a week, do you tell you to come back in a few more days or a week? Or do you say, I'll see you in 3 months? the process of recovery is the process of monitoring. And you need a lot of monitoring and adjusting, especially with serious conditions, to get better. So the process of finding a doctor is simple. It's just finding the doctor who has that process. While we're on that topic, let's just talk about medical experts for a second. I'm a qualified medical expert in the legal system. I review files and medical care for a variety of different insurance companies as well as for other reasons. I've been a chief reviewer for the Department of Education for reviewing university grant-based funding for new programs. I've developed new therapies, got patents on them, been quoted in the literature. My work's been peer-reviewed. So I guess under many situations I would be considered an expert. And I got to tell you, I'm not an expert. There's nobody an expert. The day of the expert is gone. I'm a neurologist, and in neurology, we deal with the brain. And the brain, we all know, is the most sensitive organ in the body, and anything that can go wrong in the body can show up as a symptom in the brain. Now, in my field, I did a Google search, actually a PubMed search, which is the National Library of Medicine, in which peer-reviewed articles are published. Not all peer-reviewed articles, but a lot of peer-reviewed articles are published or republished there and listed there. And in the last 5 years, there's been 192,000 articles that are tagged with the line neurology. They're focused for a neurologist. 192,000 peer-reviewed articles in just the last 5 years. Now, the average neurologist might read 300 articles a year, and that's maybe 500. We'll give them the benefit of the doubt. That's 50 articles a month, or 40 articles. That's a lot of articles. Many people only read 3 articles a month. So I read thousands, but thousands is not 10,000, 20,000, 30,000. It's thousands. There's been 192,000 peer-reviewed articles in the field of neurology in the last 5 years alone, listed in just a single database. Another database, the RIA database, deals with enzyme reactions. It has 5,000 key reactions, chemical reactions, of which each one it identifies there's 3 associated reactions. So that right there is around 14 or 15,000, depending on how they count the specifics. But if you ask any of your doctors to go through the chemical reactions, the biochemical reactions to the body that they know each of the enzyme systems involved, they might come up with 1 or 2 or 3 or 4, and they won't come up with the individual components that lead to those. And yet, all of those reactions are crucial to the field of neurology, as well as everything else that's published in the literature. There's been 30 million articles in PubMed that are listed as of today. Every single one of them applies to the field of neurology, and I haven't read them. There's nobody that has read everything or knows everything. The fields are way too complex and way too interlocked. So the idea that there are experts any longer is just really not the thing. When you look for a doctor, you need to look for his results or her results, and you need to look for the process that they use to get those results. And the process is frequent follow-ups, frequent adjustments, listening to the patient, talking to other physicians, getting good results, but getting good results come about from listening to other patients and focusing on the patient. And that is the most important thing for finding a physician or any other allied professional, whether it's a chiropractor, a physical therapist, nutritionist, anybody in the field of medicine. You're looking for the process that they use, because the process picks up when they think it's one problem causing a symptom, but it's actually something else. The process of reevaluating a person allows them to identify that they're wrong and that they need to look for something else. It's a winnowing down of what the situations are until they run out of solutions, at which point they start to contact other people around them to find this additional options for solutions. So again, it's the results and it's the process. And that's how we look for a great physician, and how we find maybe somebody who's not an expert in the field, but somebody who can be your expert.